I'm listening. I see your heart is glistening up the storm. I know this is the norm, but it's always beautiful. Glad to be your friend. Oh, this love.
I really enjoy this population, mental health, especially the inpatient psychiatric type of setting. This is the only inpatient psychiatric facility here in the state of Hawaii. And almost all of our patients here are dual diagnosis. All of our admissions are court ordered, including those that are civilly committed. So we have patients who are here as deemed unfit to proceed. So they're here to gain legal fitness. We do have patients here who are on a revocation of their conditional release. And depending on their court status, some of them, or their legal statuses are changed to acquit and commit. We see a lot of schizophrenia, bipolar, a lot of personality disorders, and a lot of them are coupled with drug abuse. So there's a lot of psychosis that are what they say like not otherwise specified, like it mimics other diagnoses. But I would say those are the most popular that I see. Majority of the population is male. I would say about 80% is male, maybe even higher. 80 to 85% is male. And age range, I think I've worked with as young as, well, it would be like 18 to geriatric stage. So all of the classes here are, or in this department, are client-centered. So there are a number of classes that work in a group setting versus like a one-to-one patient ratio. We try to find activities for the patients that are meaningful, and then from there help them to like function in the community as independent as possibly. So our work programs basically simulate a work setting. So we teach them a lot of work skills to be able to get a job outside the hospital as well.
So what kinds of programs do you have here?
For the work simulated classes, we have aquaponics. So they're taught like pH levels of the tanks. We have greens and beans class, which is one that I run. So I stress teamwork building skills, stress sanitation, that kind of stuff. We also have an aloha garden. So they're outdoors. They're again working as a team, working with people, kind of teaching them like sustainability, being able to grow a small garden, just things like that. Yeah.
And what is the Beans and Greens program?
It's a cafe. It's a Greens and Beans cafe. So it's like patient and staff collaboration. So they're able to think of smoothie ideas. Where we serve it to the staff, so they're able to purchase smoothies that the patients make, as well as like espressos or lattes, that kind of stuff. And the money that we make just goes right back into our vocational rehab account that supplies our groceries and things like that. I think just being able to find something that is purposeful to the client, given the right tools and foundation to make it outside, in the community. I think that's what we stand for, being able to basically provide the tools to live life outside. I think OT is a profession that is constantly evolving. So it's much different from your traditional, in-class setting. So we have a number of programs here at the hospital that I feel can adapt to just about everyone here, or in fact adapt to everyone here. Programs like the animal assisted therapy program, the dogs help in a number of ways that a lot of humans can't, I feel. We also have a transition to discharge class where we take the patients outside in the community and help them to locate community resources. We teach them budgeting skills, etiquette, social skills, that kind of stuff. And the garden, again, is an outside program. They're out in the sun. It's a completely different setting. They're able to get fresh air. Just cardiovascular work. It's that emerging area that I think helps a lot of people. I definitely feel it's more non-traditional. Like I mentioned earlier, like the different modalities that we use, like the animals, the garden, very different. And I think we're able to help patients who aren't used to that traditional classroom setting. What I enjoy most about this setting is being able to see them succeed. So, for example, for my greens and beans cafe class, the patients that are discharged, I'll get a call like several months later from them asking them for like a letter of recommendation or a reference letter for a job that they're applying for. So to me, that is the reward. That is like the end goal, the end product. I think what led me into the mental health field, I just love kind of like that psychology aspect, like the human mind really intrigues me. So constantly learning about disorders or the different diagnoses is pretty intriguing for me. I actually plan to stay in the mental health field just for that reason. I have a lot of ideas that I want to bring forth in the next 5 years.
Sure.
So I think this is where I want to be.
Awesome.
For me, like I can't just leave work at work.
Yeah.
You take a lot of, for a lot of these patients, you are their family. They don't have that moral support, that social support outside of the hospital. So, they give you their life, so you're their caretaker, you're their healthcare provider, but you're also that friend to them as well. So, outside of work, I'm constantly thinking of ways to better my programs or to help, the patients I work with. So for me, that is a struggle. I think there are a lot of community resources as far as them being able to access it. There may be, I guess, some problems in that area, just having even something as basic as like transportation, I feel, or having the support to keep them going to, like AA meetings or NA meetings, or like the United Self-Help programs that they offer throughout the month. Maybe difficult for some of them.
Sure.
I think that with our transition to discharge class, I think that's a really big help for our patients. We work with patients who are near discharge, so a lot of the outings that they do take them to the different areas around the island. And what they do is, for the patients that are in the class, they find out where the plan is for discharge, and we kind of, if we can, we'll take them to that place, whether it's Puailani Drug Treatment Center or Ho'omakeola in Waianae, just to kind of get them familiarized with the area and the resources that are there. But I think that with that class and the help of like social workers, we can provide that help that they need once they leave, once they're discharged.
So some of the things that are really helpful about this class is that we're basically given a similar setting to if we're working, and we basically have responsibilities that we're able to uphold to, whether we're using knives and cutting things, or whether we're trying to juggle doing smoothies and cleaning up. It's challenging, and it's a good challenge because you're able to learn from one another and to give a service to the hospital. So it's kind of a multifaceted thing. It's really helpful in the fact that we're able to be responsible, that we're able to work, and that we're able to provide a service and stay active.
And low-level stress.
Yeah, and it's a low-level stress thing because we're able to manage what we're doing, and it's not like we have somebody sitting over our shoulder telling us, "Hurry up, do this," or you need to do it this way. When if we have challenges, we're able to work them out, and it's more of like an open setting than very rigid. Yeah.
So, do you think that these kinds of programs make you feel better about yourself and your abilities?
Yeah. It's neat to basically like try new things. Like we spend a lot of time on the unit, and so it's a lot of downtime. And personally, like when I'm not doing something, my head just goes inward, and I like being active and dealing with other people because it gets me outside of myself. So with this class, we have freedom to try new things. The chocolate walls was something that I was able to add, and one of the staff loves it, and she comes back weekly to get it. So there's freedom to try new things, and in doing that, it's really, I enjoy it because it's a service that helps others. I get to learn new things, and it's mutually beneficial.
Yeah.